Hey guys, it's Dr. Justin Marcagiani here. Today's video is going to be on headaches. We did a nice podcast today on the topic. We'll put the link down below, so if you want to subscribe to the podcast and get more information there, we'll have that link for you. So we're going to talk about headaches, the structural, the chemical, and some of the nutritional causes of headaches. Before we do, make sure you smash that like button. Really helps the search algorithm. Also, put your comments below and make sure you share with friends and family. All right, let's dive in. So headaches, we have different kinds of headaches. We have cluster headaches, we have migraines, tension headaches. We have headaches that can be caused from lots of different root cause reasons. The type of headache doesn't necessarily matter too much to me. I mean, of course, like migraines and cluster headaches can be more debilitating, but the root cause for some of these headaches could be similar. So one of the first things could be structural. So we could have issues with the spine not moving properly, alignment issues, or just fixations in the joints or subluxations in the joints, whether it's C1, C2, or in the cervical spine, and that can create distortion from the brain because we need movement for the brain to communicate to the rest of the body. And if we don't have good movement, that can be a problem. If we have issues with pliability in the muscles, right? A lot of muscle tightness because of upper cross syndrome, right? Tightness in these muscles here in the deep cervical flexors, weakness in the extensors, tightness in the pecs, weakness in the back rhomboid extensors. That's called upper cross syndrome. So these muscle imbalances from poor posture, sitting at desk all day, inflammation, lack of pliability in the muscles, these can all be potential root issues from a structural standpoint. Of course, when you have adhesions and pliability issues in the muscles, you can develop trigger points and trigger point referral. So for instance, like the SEM, for instance, you could have trigger points along the SEM here, and that could refer up to the head and around the eye area, right? So trigger points could manifest in different areas than where the trigger point's actually in. So soft tissue work and myofascial release or active release technique can be helpful. Good chiropractic work and making sure the cervicals are doing well. Seeing a good applied kinesiologist to make sure the scalenes and the SCM and the extensors are turned on and stabilizing the neck well. Now, of course, foods like gluten and casein and inflammatory junky fatty acids, right? Plant-based refined junky fatty acids, trans fats, refined sugar, of course, gluten. All these things can drive inflammation. The more inflammation you have, the more you're going to have constricted blood flow. The more the tissue's going to lose pliability, the more things aren't going to move well, right? Inflammation causes things to stick. It constricts. It's tight. Lack of pliability, lack of ability to absorb force. So you're more likely to have issues in the joints when things are sticky, not pliable, not absorbing force, and lots of inflammation. So the joints can play a big role with a lot of the inflammation, right? So a lot of diet stuff plays a big role. Of course, just certain nutrients, like having adequate B1, B2, B3, B6, right? Thiamine, riboflavin, niacin, pyridoxal 5-phosphate, right? Really important nutrients, magnesium, CoQ10, right? These really help the brain work. They really help with headaches. When these nutrients are low or deficient, you can see more headaches. So just eating more processed food, not having a nutrient-dense, anti-inflammatory, low-toxin diet can drive these things. And then, of course, hormone issues. If you're a female and you notice headaches happen around ovulation or pre-menstruation, there could be estrogen dominance issues, low progesterone, hormonal fluctuations that could be driving a lot of these headaches. So you have to look at the hormones. That plays a big role. If you're having symptoms that are non-cyclical, right, meaning not based on your female cycle, but they're just happening day in, day out, there could be blood sugar issues, right? Dehydration issues, lack of minerals. When your blood sugar goes up and down, you can actually have lots of adrenaline and stress hormone release, and that can easily be driving some level of inflammation in the body, and you could be having a headache because of it. Certain inflammatory foods like gluten also decrease blood flow to the brain up the carotid artery due to the inflammation of that food. So foods can drive inflammation, which can also decrease the perfusion of blood and oxygen to the brain, not just the structural component, but also the blood flow component. And of course, inflammation in the gut can move its way to the brain, right? That's called, bacterial lipopolysaccharides, bacterial endotoxins, gut infections, gut permeability. Things go from the gut into the bloodstream. Once in the bloodstream, it can cross the blood-brain barrier, okay? Those are a couple things you want to think about. You really want to get to the root issue. People have different underlying root issues all the time. I focus on the root underlying problem. Hormones, gut, detox, structural components, nutrition, blood sugar, adrenals. Of course, the adrenals play a big role with the blood sugar. A lot of blood sugar goes up and down. When your blood sugar's on that roller coaster, there's lots of insulin at the top and lots of cortisol and adrenaline at the bottom. So you're on this cortisol, adrenaline, insulin, cortisol, adrenaline, insulin, and that can create a lot of stress in the body. So Just want to put that out there for you folks. If you think you have underlying issues and you're struggling, and then they're giving you the Topamax or the ibuprofen or the Excedrin, right, and you're not getting better, well, you want to dive in deeper and really look underneath the hood. I'll put my link down below where you can reach out to me. I'm available worldwide for functional medicine health consultation support. Feel free to apply something in this video so you can at least get some moving on it, get some momentum and some healing going in the right direction. Hope this video was insightful, and if you enjoy it, thumbs up, like, comments down below. Really appreciate it. All right, let me see if I have any questions here to dive in on off the bat. Let's see. Headaches stink, especially some with health anxiety. I do wood flooring. I'm hunched over all day, head leaning forward. Yeah, that's tough. That could definitely be a big factor. So someone like yourself, you're going to want to make sure you're seeing a really good massage therapist, probably weekly, maybe a good chiropractor too. And you probably want to have some really good structural or some good postural exercises to do to help kind of keep that dial in. I mean, I would just say if you're bent over, still try to keep a relative neutral spine when you're working and doing things, just so you're not overly hunched, but you're keeping that good neutral spine. So just do your best on that. Swollen right supraclavicular all of a sudden. I can before conventional med tells me everything is cancer. Could chiropractic help? Yeah. I mean, you got to get to the underlying reason why. Absolutely. I mean, if it's lymphatic stuff, that could be from other things, but got to look at the underlying issues. Okay, excellent. All right, I don't see any other questions today on the topic, so I hope you guys today enjoyed today's video. Comments down below, and take a look at today's podcast. Hope you guys enjoyed. Have a good one. Take care, y'all. Bye.